Hi, I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist, and I provide education and commentary on injuries and injury treatments and injury prevention for athletes and active people so that you can stay healthy and perform your best. One of the questions that I get, it seems sort of counterintuitive, but when I see patients in my office and maybe I get an MRI of whatever the particular injury is, sometimes people are actually disappointed when I tell them that the MRI is negative. Now, they're relieved, I guess, that potentially they don't need surgery, but they've been hurting potentially for weeks or months, and so they want to know, how can it be negative? I keep hurting. And so I think that that's an important discussion. Is MRI ever wrong? And can it miss something? And so in today's Ask Dr. Geyer video, I addressed that very question actually with a common chest injury, a pectoral injury. Scott asks, I was wondering if a shoulder MRI will show a pectoral tear. I injured my chest and arm, but the shoulder MRI is showing nothing wrong. Do I need a chest or arm MRI? Well, that's a terrific question. And the reason it matters is, let me explain this. So the pectoral muscle, pretty common, everybody knows what that is, can be injured in things like bench press. So you do a bench press, maybe the weight slips and it jerks your arm suddenly, and you can injure either the muscle belly or you can injure the tendon that attaches to the arm. The arm and the chest turn black and blue, it swells up, and they're in a lot of pain. The reason it matters where, is it a muscle belly, is it the tendon attachment to the bone, or the junction between the muscle and the tendon, is that some of those injuries need surgery. The muscle belly we typically get to heal on its own. Rest, maybe ice, and then when they're feeling better, of course, we'll work with a physical therapy and can do really well. But if the tendon pulls off the bone, very frequently we're fixing those, especially in active people, athletes, we choose to fix those surgically where we reattach the tendon to the humerus. And that does really well, but the way to really figure out whether or not that's what it is to get an MRI. And so, yes, it can be difficult. Sometimes when you get a shoulder MRI, it doesn't go low enough to actually see the pectoral tendon insert on the humerus. So in theory, it could just be that it didn't show you that. A chest MRI, yes, would show you the pectoral tendon injury. The advantage of getting the shoulder, though, is you look at other structures in the shoulder, the labrum, the rotator cuff, the biceps tendon. So what I typically do is I'll order a shoulder MRI, but tell the radiologist, and I like to, for these, send these studies to be read by a musculoskeletal radiologist and tell them I'm looking for a pectoral tendon injury, and they can adjust the sequences to go low enough to potentially show it. But the key is that the doctor or the orthopedic surgeon communicates that. There's absolutely nothing wrong with getting, I would think, a chest MRI, but I think the take-home message for you potentially as a potential patient is to communicate that with the orthopedic surgeon. The doctor can then communicate with the radiologist to make sure you get the appropriate test. But an MRI can show a pectoral injury. You just may need to tweak it. It may not be a shoulder at your facility, it may be a chest, but yes, we can absolutely find it. Now, have you suffered a pectoral tendon injury, and what did you do about it? Did you have an MRI? Did you end up going through surgery? I'd love to hear your experiences. So below this video, please leave your comments. I'd love to hear how you dealt with it and what your experience was. And if you have friends or maybe family members going through a pectoral tendon injury right now, please share this video with him or with her. I hope it can be helpful in some way and help him make an informed decision about what he wants to do that's best for his basically body, for his chest and shoulder. Now, if you like videos like this and want more information on injuries and injury treatments and injury prevention in sports and exercise, subscribe to my video channel. I record 1 or 2 of these videos every single week, and they'll get delivered directly to you. And last, there's so many resources that I create on ways to stay healthy and perform your best, whatever your sport or whatever exercise you like to do. So, and I only share them for free, mind you, but I only share them with my email list. So go to my website, drdavidgeyer.com, and enter your name and your email address right at the top. You'll get a free ebook on injury prevention. It's called The Year of the Healthy Athlete. I think it's really helpful, all kinds of injury prevention tips, and I share them regularly with my email list, so go sign up. I'd love to communicate with you that way. Thank you so much for watching. If you have any questions you'd like me to answer in a future Ask Dr. Geyer video, definitely send those my way, and I look forward to seeing you right here next time.